All right, hello everyone. My name is Maggie Redston Davies, and today I'm going to be sharing my practicum experience with you. So I'd like to start by acknowledging I currently reside on Treaty 4 territory, traditional lands of the Nehiyawak, Anishinaabe, Dakota, Lakota, Nakota, and the homeland of the Métis Nation. My practicum placement took place in Regina, Saskatchewan at the Regina Food Bank. This is a non-profit charitable organization working to fight food insecurity. The organization was founded in 1982 and remains Regina and surrounding areas' largest direct service provider for people experiencing food insecurity. So the vision of the Regina Food Bank is individuals and community working together to address hunger and sustain independence. The mission is to serve those most vulnerable in the community by providing programs and services in the areas of food provision, essential skills development, and connections to community. Since the beginning of the COVID-19 pandemic, the food bank has had some drastic changes to service delivery in order to meet the needs of the community and ensure food services remained accessible during lockdown restrictions. Some of the innovative new services that were developed in response to the pandemic included delivery and drive-through food hamper distribution. So during my time at the food bank, I reported to the coordinator of service delivery. Early conversations with my practicum supervisor determined the main purpose of my practicum placement would be to bring an outsider perspective to identify barriers, gaps in service, and strengths at the Regina Food Bank. The evaluation, problem solving, and critical analysis knowledge I gained through my coursework was used to create a set of recommendations for improving services related to community health outcomes. So the first skill that I focused on during my practicum was to demonstrate cultural humility and critical self-reflection when analyzing public health information and interacting with diverse individuals, groups, and communities. Knowledge from various Indigenous health courses guided my intentions and helped me incorporate cultural safety and diversity into my interactions daily, as well as my routines and observations. This involved being self-aware and reflecting on how my position has an impact on the relationship I have with others. Working at the front desk and interacting with a variety of staff, clients, and community members, I applied knowledge from the program to ensure my observations were a basis for learning. Instead of focusing on what I perceived to be barriers and challenges, I focused on having genuine and respectful conversations with people and practiced cultural humility. In turn, this created a safe space for deeper conversations in which opinions, ideas, and thoughts about services and challenges were expressed. So the second skill for my practicum was to examine the role of community engagement and community leadership in promoting population health and social justice. Working at the Regina Food Bank means working as a team. Using the interprofessional competency framework as a guide, I was able to work collaboratively and in partnership with clients, staff, volunteers, and community in all aspects of daily operations and routines to ensure shared decision-making and engagement. This involved actively seeking and clarifying client, staff, volunteer, and community goals, values, needs, and feedback to guide coordination of services and quality improvement. And the third skill that I explored during my practicum was to demonstrate the ability to support the planning, implementation, and evaluation of health programs. This involved assisting in the development of a client feedback survey aimed at identifying the needs of the community to inform programming and improve services. Using knowledge and tools from program planning and evaluation coursework, I was able to work in a timely manner to assist with the development of program goals and measurable objectives. For this part of my journey, I used SMART goals and action planning to stay focused and on track. During my time at the food bank, the survey questions evolved and eventually came together to provide comprehensive data that captures both struggles and strengths in the community and can be used to improve health outcomes. So based on observations and conversations with staff and volunteers, I developed a set of recommendations for management aimed at improving services that directly impact community health outcomes. One of these recommendations included expanding partnerships with Indigenous communities and organizations. By creating a list of comprehensive, easy to read recommendations and resources for both staff and management, I was able to support the organization further realize its current strengths and barriers and provided useful resources to help improve services. So my most memorable experience, although there were many, was helping with the deliveries. Delivery drivers go out every day of the week, all year round, and deal with some challenging conditions. The delivery drivers are dedicated, caring people, and the work they do goes above and beyond food delivery. Many of the stories I heard involved traumatic and challenging situations. One driver expressed to me their concern around the lack of training they receive for the extra tasks that come with the job. This individual loved their job and had a true passion for helping people. Throughout their time at the food bank, doing deliveries, getting to know people who use the service, they developed a great deal of knowledge on the community's needs and current challenges. Using various skills from the program, I was able to include the recommendations and ideas for training that staff had articulated into recommendations provided to management. Some of the things employees touched on included a need for training that addresses social issues in the community, such as mental health first aid, naloxone training, and assist training for suicide intervention. Included in these recommendations was an outline of employee strengths and a highlighted need for regular team meetings that focus on frontline workers getting a chance to express their ideas, concerns, and experiences to better inform food bank programs and services. So during my time at the food bank, I saw a strong sense of community and came to appreciate how much can get done when community comes together for a common goal. As I mentioned earlier in the presentation, the Regina Food Bank has had a lot of changes since the COVID-19 pandemic. Based on feedback from staff, volunteers, and clients, I recommended increasing partnerships with local organizations to develop programs and classes. For example, cooking classes that use ingredients from the food hampers and focus on teaching basic cooking skills and nutritional awareness. One agency I suggested increasing partnership with is an Indigenous-led organization called the Comeback Society, which currently uses the food bank's commercial kitchen to prepare meals for the community on the weekends as a part of their mission to make food a tool for reconciliation. So the Regina Food Bank offers immense opportunity for growth when it comes to developing partnerships with Indigenous communities and decolonizing the organization. Indigenous health follows a holistic model encompassing 4 dimensions of health: physical, mental, emotional, and spiritual. Alternatively, Western biomedical concepts of health are narrow, with a focus on disease and infirmity. Working in multidisciplinary teams, I use the knowledge I've gained from the PHSP program to advocate for programs and professional development that improve health and reduce health inequities among Indigenous communities. This was done using knowledge and guidance from Indigenous concepts of health and well-being, which included finding a balance between mind, body, spirit, and emotion, as well as living a good life in harmony, reciprocity, and relationship with other human beings and the natural world. With this being said, I have chosen call to action number 22. We call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. As a graduate, I will continue to recognize the value of Indigenous ways of knowing and healing practices and help others see the value by empowering Indigenous voices and experiences to share this knowledge. I will encourage individuals to share healing practices that bring them value and advocate when those resources are not available. To further operationalize this call to action throughout my career, I will advocate for consultation and relationship building with local Indigenous communities, partners, and organizations. The most meaningful part of my journey has been getting to know the people and partners involved with the Regina Food Bank. For such a large operation, it is a surprisingly small team of paid staff keeping everything going, who work endlessly to improve services and support others. By focusing on developing strong relationships early on, I gained a wide range of perspectives and experiences in a short span of time. The most meaningful aspect of the BA program, and something I will continue to develop, is self-awareness and awareness of myself in the community that I exist in. Thank you to my practicum supervisor, Jen Marshy, and the team at the Regina Food Bank. Everyone at the organization works extremely hard and has a true passion for helping others. I'm going to miss the jokes and laughter from the team every day and feel thankful to have been part of such an amazing team. I also want to say thank you to all of my fellow students, professors, and staff within the School of Public Health and Social Policy. The last 2 years have been truly life-changing, and I will always remember the compassion and care that I was met with throughout the program. Thank you.